Hello and welcome to i-HSEQ. Today is a short video made for those businesses that are hopefully going to be opening in the coming months now the government's announced their roadmap to opening all Remain businesses in the UK, which is great news. Before we look at how to stop the spread, let's start by finding out how it spread in the first place. COVID-19 is caused by the SARS-CoV-2 virus, which spreads between people, mainly when an infected person is in close contact with another person. The virus can spread between people's noses and mouths in small liquid particles when they cough, sneeze, speak, sing, or even breathe heavily. Now these liquid particles are different sizes, ranging from large respiratory droplets to smaller aerosols. Other people catch the virus when it gets into their nose, mouth or eyes, which is much more likely to happen when people are in close contact. Now close contact is less than 1 metre apart. Now the virus can also spread when infected people cough or sneeze or touch surfaces, making those surfaces contaminated. Other people become infected when they touch those surfaces and then touch their own eyes, nose or mouth. You can see why it's so important to keep distance, perhaps keep your face covered and ensure good hygiene measures in place, both of you washing your own hands and cleaning surfaces. Now infected people can spread the virus whether they have symptoms or not, and lab data suggests infected people are most infectious 2 days before they develop symptoms, if they do develop symptoms. People that don't develop any symptoms can still pass the virus on. When this is still not clear and more data is needed. There's certain settings when COVID can spread more easily, and the World Health Organization refers to them as the 3 Cs. Crowded places with people nearby, close contact settings, especially when people are having a face-to-face conversation, or confined and enclosed spaces with little or no ventilation. And of course, where these 3 Cs overlap, the risk is even higher. So a crowded, confined space with lots of people having conversations. So now we know how the virus is spread, let's look at what control measures we can put in place to reduce that spread. So as with any risk assessment, we are going to use our hierarchy of controls. First thing we're going to look at doing is eliminate. What can you eliminate in your workplace to reduce the risk of the spread of coronavirus? The second thing is to replace. Now an example of this in a pub or a restaurant where people used to come up to the counter or the bar and order and pay, table service replaces the need for people to go to the till. Then we have engineering controls. Now ventilation, fans, air conditioning, they're all engineering controls. Screens that you can put up in front of the counters to stop the spread going across is another good engineering control. Administrative controls like signs, please wash your hands, please stay 2 meters apart. Administrative controls. And then finally, and my least favorite, PPE. PPE has been a big subject with the whole coronavirus outbreak. Examples are masks. Now masks are only PPE if they are proper face-fitted masks. A simple face covering does help reduce the spread, but it isn't actual PPE. The other thing that's been used a lot is gloves. Now gloves can be really good in certain situations, but you still need to have good hygiene measures. You need to wash your hands before you put the gloves on. You need to then put the gloves on safely, touch any possibly contaminated surfaces, remove the gloves safely without contaminating your hands or your face, dispose of the gloves properly, and then wash your hands again. So as you can see, as a general control measure in the average work setting, gloves really aren't very effective. If you want to know more about the hierarchy controls, if you haven't seen my risk assessment video, I will stick a link to it right now somewhere here. So we're going to do a coronavirus risk assessment. And please, please, please make sure that you record your risk assessment, write it down by hand on a computer or on my free template, but get it recorded. The HSE are doing workplace visits. There are COVID marshals. There are people representing the council, and there are people out there looking to see if businesses are compliant or not. Make sure you have a document stating what it is exactly you're doing to ensure that your business is COVID secure. Now this is a short video, and it's a short video because the principles of risk assessment stay the same. The principle of stopping the spread is very basic. There are detailed explanations for each individual industry, and I can't go through all of those. So I put a link into where you can find your industry specific guidance. However, to break it down, there's 2 different types of guidance. There is mandatory guidance. Mandatory guidance at the moment is that everybody should be wearing a face covering in a shop unless you're exempt. With more businesses open up, they will have certain restrictions placed on them, like numbers. So how many people you can have in an indoor setting, or how many people can meet up in a group, which is going to be 6. So if you're a pub or a restaurant, try and ensure that people can safely sit in groups of 6 and that those groups of 6 are suitably spaced apart. Social distancing. So social distancing is a recommendation. Social distancing, where possible, stay 2 meters apart. Where possible, not you must. Of course, it's the further you can stay apart with your staff or your customers or the members of the public is going to be better. Close contact is 1 meter or less. So where you cannot stay 2 meters apart, especially for your staff if they're in a tight, small environment, face coverings or getting people to pass side by side or back to back is going to be much better than passing face to face. Seating table arrangements where your customers' chairs are back to back is going to be much better than they're in a situation where they could be face to face. Another great control measure is hand washing and hygiene. So in your workplace, if you ensure that there is alcohol hand gel available for members of the public, most of them are going to use it. Put a sign up as well, which is another great administrative control to remind people to keep their hands clean. That's going to help reduce the spread. And we all know about hand washing by now. The hygiene in your touch spots in your business is also going to be vital. Counters, handrails, anywhere where people regularly touch, where they're going to touch their hands, where they're going to touch their face, and then touch the surface. These areas need to be cleaned regularly. Now, how regularly depends on how many people you have coming through the door and passing through those areas, and how regularly they're touching the particular object. Ventilation and air conditioning is another great way to reduce the spread. Keep those windows open where you can, keep the doors open. Keeping doors open is also a great way to stop people touching door handles and spreading the virus that way. Now, all the research I've read states that air conditioning is perfectly safe to use and is actually advantageous in keeping the spread down. So don't be afraid to keep your air conditioning on. But I much prefer fresh air. Now, if it's freezing cold, raining sideways, then don't have doors and windows open. Then you don't have to have doors and windows open. The point is where you can. Now, when you're looking at your business and how to set it up and how to reopen, make sure you speak to your staff. They need to understand what you're doing and why, but also they may have some really good ideas on how you can lay your business out or reopen safely. Consultation is always vital in good health and safety management. When you've completed your risk assessment, your workplace is set out just right so people can stay socially distanced, got access to hand sanitizer and a place to wash their hands. The next thing you need to do when you're confident your COVID is secure is to display this poster. Now, I will put a link to the poster, the World Health Organization's website, and also the i-HSEQ's website, where you can find your industry-specific guidance. Thank you so much for watching today. I really do hope that this has helped you businesses out there that are about to start opening, that are planning on opening, how to open safely. If you've got any comments, queries, or want to know a bit more, please do stick a comment below, send us an email, get in touch. We're always happy to help. Stay safe and good luck.